Hi, this is Dr. Khan. So I've done what is a complete En Bloc 51325, initials HJ. This is a nice lady from the state of Washington. She got implants in Korea in 2016. Now, according to the ultrasound that she had, it stated that the implants were subpectoral below, which is incorrect. Her implants were above. And she said that the ultrasound also said these were silicone. So what I'm going to do now is I'm going to go ahead and cut this open. This is the En Bloc, complete total capsule implant removed. As you can see, there's a lot of inflamed tissue. I did not like how this feels and touch. When I touch this, it palpates different. It's abnormal. It was sitting right on top of the pectoralis, so the fascia of the pectoralis major was removed. And what I'm going to do is, I find that it is important to remove this tissue. As you can see, if I cut through it, you will see, look at this scar tissue type of a consistency. So I'm going to go ahead and go in from this level. You can see the quality of this tissue is not good, and hence it was removed. It was a grade 3 capsule or contracture. It's hard like a ball, suffocating, i.e. contracting this implant. This was done En Bloc. I removed the excess skin at the bottom, as you will see. That helps with the contouring because the implant's kind of working as a tissue expander, if you will. So I'm going to go in very carefully. These are implants from 16, so they're not that old. And if you look at this, many people ask, why are you removing this tissue? Because this is precious volume. Just by looking at it, you can see it does not look healthy. It is hard and abnormal. So one way, just remove this capsule, leaving this behind. In my practice, I remove all of this as well. So as I go in, I'm going to go ahead and go in from here. Look at it, has this brown tinge consistency to it. I'm going from here. Again, it's super tight. I don't want to hurt the implant. Blood loss was minimal. Relatively small implant. Alright. It's persistent. Let me go in from this level. So again, as you can see, this tissue, not good, not healthy. It has to go. In my practice, anything remotely suspicious, I remove. Let me cut this open, see if I can find a good entry point elsewhere. All right, let's try this one. So here we go. So 9-year-old set of implants. Nice. Oh, so what I'm going to do is, Kelly, if you can give me a syringe. This one right here. I'm just going to go ahead and I'm going to go in from here. See, you never know what you're going to find. Let me go in. Looks like a textured implant right here. And now, as you go up, None of this spilled into the chest. Remember, any fluid around the implant is a concern for any potential malignancy. Now, it's not enough. None of this spilled into the chest, and remember, that's the whole purpose behind doing the En Bloc. Look at the color, the consistency of this. So silicone implant, indeed textured, and look, it has this hemorrhagic fluid around, not too much. You have to have like 3 cc's or so. None of it spilled into the chest. And look at the bloody fluid around, all removed. Look at the way the implant was suffocated in, contracted in like this, and balled up, if you will. If I press like this, this is how it's supposed to be sitting in the grade 3 capsular contracture. So I cannot tell what make or model this was. These are Korean implants, intact silicone textured implant, and again, a super thin capsule. Very tricky case, a lot of inflammation around, and I can only imagine how the patient's going to benefit from this explant. So again, very, very thin. You can see my green glove underneath. So if I put it here, you can literally make out the inch, centimeter. You can see the ruler right behind it. So no matter how thin the capsule, it has to go. You know, this nice lady and her significant other did like a nice homework, and they were well read. And so overall, I'm very pleased with how the surgery went. I'm going to remove my top glove. It's the sterile glove. You never know what you're going to find, so you don't want to cross-contaminate. I see some surgeons use non-sterile gloves. You want to get a new set of instruments in case you find some fluid around, you want to send it off. And I'm going to send it off to micro. I don't want to cross-contaminate. So you want to do it on the table. I also saw one of the patients, there was no name, there was no initials, no date. You have to write down, even as a surgeon, after some time you're going to forget who was what. So you want to write down the date here and up here, and you want to write down the patient's initials. There's no HIPAA violation. And you want to use sterile gloves, because I will tell you that's proper etiquette technique, so that if you ever need to go back and look, you're not going to be able to confuse those patients. Because you cannot tell by looking at implants what was what. Sometimes you have an imprint on the high definition pictures and videos, but sometimes if you don't turn it on or you don't have it, that will be a problem. So as I go in, again, this is the textured nature of this implant again. Very tightly adherent. That was the whole purpose behind the textured, and to decrease the contracture rate. As you can see, she had a grade 3 on both. Grade 3 capsular contracture left side. I removed a lot more skin on this side because there was asymmetry. I measured the distance from the nipple down to the crease on both, so make it symmetric. Again, you can see how thin. Intact implant, made in Korea. You can see there's no hemorrhagic cystic fluid here. Very, very thin capsule. As you can see, if you look at my green glove, you can see right through it. Some areas relatively thick, and that's why I remove all of this tissue that's basically inflamed. So I always like to see if there's anything abnormal. Again, very thin capsule. The goal here is En Bloc, En Bloc, En Bloc. If there was a small, even 1 millimeter tear in the capsule, it becomes 100% total capsulectomy. So over here, there is no name or brand or make or model. These are your textured implants. So you will see, look at this fluid. It's very slimy. So the En Bloc, which is 100% total capsulectomy without any breaks of the skin, total capsule removed. The implants will be returned to the patient, capsules to be sent to pathology, rule out the rare BIAL, CL, CD30 analysis, cultures for Arabic, anaerobic, and fungal, twilight deep sedation, no need for drains, no need for the unnecessary lift, severe inflammation, and there you have it, the Con procedure, executive plastic surgery.